Matthew Holt with the Healthcare Blog. I'm still at HIMSS. I'm now with a company who I know very well, and we know very well in the Bay Area, but not necessarily known as an information technology company, but probably one of the biggest and most active and possibly best technology users, Kaiser Permanente. And with Phil Fasano, who is the EVP and also the CIO of the whole operation. So Phil, welcome to the Healthcare Blog.
Thanks, Matthew.
So tell me a little bit about where we are. We've had Health Connect now completely rolled out across the Kaiser system. I think that's correct?
That is correct. It's in all our hospitals and all our medical clinics at this point.
Okay. And then talk to me a little bit about some of the impact that's had from the clinical side as well as what it means for you on the technology side.
Well, I'll start with at HIMSS, we were just awarded another 11 HIMSS Stage 7 awards for our hospitals. So 35 of our 36 hospitals are at Stage 7, which means they're paperless. So from the moment a patient walks into one of our hospitals, regardless of where they navigate through the hospital, all of their information is always available throughout their visit and their stay, and all of their care providers have the most current information about their status. That translates into better quality, effectively better care, and better outcomes for all of the patients that use our hospitals, as well as all the patients that go visit their physicians, primary care, and specialists in our medical clinics. So having KP Health Connect has been dramatic for us in terms of the ability to have all the information about all the patients all the time. And it's every one of our patients, every one of our members now has access to it. All of our physicians and clinical staff have access to it. And it's just been a great advantage to us as a system.
So let's talk a little bit about some of the early research that's coming out of the health and clinical changes or health outcome changes that you guys have been releasing. I don't know how much of those have been early stage studies, how many of those have made it into the peer-reviewed journals as yet. There's been a bit of, I've made some mentions about how it's made a big difference, and I've had some people on my blog say, well, it's not peer-reviewed yet, but just talk a little bit about where that process of research of how a living system now, with everyone being tracked, is actually showing changes in outcomes.
Well, I can talk specifically about diabetics. Diabetics within our system, both Health Connect contains their information, but we also create medical registries.
Right.
Those registries follow those patients, provide information on gaps in their care, gaps in their status, so physicians and other clinicians can follow up with them. As a consequence of that, many of our diabetic patients have found that they're not visiting the hospital as often. We think that's a really good thing. That means they're healthier. It means that the benefit to them is clear, and that their outcomes are improving, and their prognosis improving. Heart patients is dramatic. If you've had a coronary artery event in our system in Northern California, the reduction to your effectively mortality has been substantial. It's up in the 80th percentile versus another system. If you were a patient of another system, that is. So the systems themselves provide the information. Our preventive care model provides the incentive and the approach, and our physicians and our clinicians use the information consistently for follow-up care for patients that really do require that kind of care.
So how much of that, just on the research topic, how much of that is in terms of going in and convincing the rest of the world, is going into the peer-reviewed literature, or is it still mostly in outcome studies done by
both of the areas I just quoted have been published,
Yep.
and published quite widely.
Right.
So it's highly recognized. Other organizations, peer reviews are being done and conducted. Peers are constantly looking at our data and testing and probing. The analysis is quite sound and is statistically relevant.
So we're having a fair amount of back chat as we went to the whole motion towards EHRs and EMRs and making digital healthcare digital at the moment. A lot of people are saying that we're putting in processes and that make life harder for physicians. Some of it's moaning around money and cost and workflow changes, but there are complaints about patient safety issues being caused by some of the systems that are going in and that kind of thing. Now, you're natural to get a reaction anyway to any new change, but can you comment about how you've seen that emerge in the Kaiser system?
Well, I think anyone who has a concern about patient safety, that's a legitimate concern for sure. What I would tell them is that information systems enhance quality, enhance effectiveness, and allow seamless sharing of information that's immediately relevant from primary care to specialty care to outpatient to inpatient, which makes all of that seamless coverage for a particular patient. Huge advantage in terms of patient care quality and services to that patient over written medical records. So from my standpoint, I think the benefits are so substantial that every system should be working toward, implementing medical record systems, and then going the step beyond that, which is connecting systems from primary care to specialists in their communities to community hospitals. Those connections are going to be so critical for other systems to duplicate the results we get at Kaiser.
So I think we'll go on to that sort of the non-Kaiser world in a second. I want to ask you a couple of things about the Kaiser world and back sort of more in your IT wheelhouse. Okay, KB Health connects in. It's been, there was obviously some teething troubles at the start, but pretty resounding success by all accounts at the moment. And I think that the word is now definitely out about you guys being a leader in this sort of health management preventive care area. However, there's always the next thing, right? So one of the things I've heard mentioned by various people in the Kaiser world is better video connections between doctors and patients and doctors and doctors. You currently have this pretty all-encompassing messaging system, but it's sort of a store and forward messaging piece. The other question is around it's pretty much a closed system at the moment, and there are third-party applications you've brought in, but it's pretty much not an open API the way that, say, Google is, where you can now start saying, okay, here's a model I can drop other tools into. So patients who want to do self-management or anything like that have their own applications they like. At the moment, that doesn't completely jive with the Kaiser system, although there are ways in and out. So can you philosophically tell me where you guys are, both from the sort of the more advanced video connection and then this concept of all those other applications out there which patients or doctors might want to use?
Well, I think two very different topics.
Questions, I agree.
So let's start with the telemedicine as a primary topic. Our organization across every one of our medical groups is currently piloting various forms of telemedicine. Teledermatology is the one that most often comes to mind and when we talk about quite a bit, because we're actively doing quite a number of office visits via video for dermatology patients. So we make dermatologists available in Southern California, Northern California, and other parts of our organization using quite significantly just simple televideo capabilities. Some use Skype, some are using more advanced video, some are in high definition. At the end of the day, we're going through all the learnings and collecting those and determining how best to support that across our entire system, because we think that's the future of healthcare. It makes care more convenient. It solves the issue of having a primary care physician have to refer a patient to a dermatologist and then go look for that dermatologist's office availability and then a week later go and see them. In our system, that primary care physician can call a dermatologist on the phone, do the video consult in their primary care office, and have an outcome as a consequence of that, and let the patient leave and go get any pharmaceuticals or any follow-up care that they need as a consequence of that primary care visit. We think that's more productive. We think that's better service and certainly a better care outcome for the patient.
So is that just to collaborate on that? At the moment, that's doctor to doctor, or the patient's in the office. Are you going to go to the end result? You're going to go direct to the patient for sort of video, online, and real-time visits?
As we're thinking about video, particularly video, we expect and fully anticipate that we're going to have to be able to support connecting to people at home. A lot of reasons for that. Elderly require it. It makes it more convenient for them. Makes it a lot more convenient. They don't have to get in their car, drive to the office, and all the inconvenience of all of that. And then it also makes their physicians much more available to them in the event that they require the higher touch interactions that can be achieved somewhat over video. Sometimes the patient needs to come in the office, but not all the time. And we're finding that teledermatology, telemedicine is a wave we'll ride. It's part of our future. We expect to fully support that.
And do you have a date in mind as to when the...
as I said, we're doing our pilots. As our organization is one where we learn, and we're going through that learning right now. So I wouldn't give you a specific date that we're going to launch a major tele capability for our whole health system. But I would say over the next couple of years, we're going to continue to expand telehealth applications across many specialties within Kaiser Permanente.
Right, so let's go to my other question now, which is the opening of the network. Obviously, your network is heavily based on the Epic system, a fair amount of modifications. I know that you guys did yourselves for both the rollout of it, but being by far their biggest customer and putting the stamp on them as the company they've become, but also in terms of the MyChart and the access for patients. And that's had substantial changes, as we know. I think Louis Gang was saying that 40% of your office visits and what have you from online visits, so online email exchanges. Now we have, going out there in the world of Health 2.0, this vast amount of new stuff online in terms of applications for patients to communicate with doctors and do self-care and all the rest of that stuff. How is that world coming towards the KP system, and how are you thinking about the integration of those two things together?
Well, KP.org, we think, is an extraordinarily valuable resource for our members and our patients. They tell us that over half our members are now actively using KP.org, so that's over 4 million members. They find it immensely convenient for their interactions with physicians, interactions for making appointments, looking at their lab results, and so on. At the same time, they also use it for its health services. We continue to expand the suite of services that members have available. Everything from weight management to fitness is on kp.org, and our members take advantage of those services quite actively and continuously integrate those services into their active use of the entire system. And the results of their exercise, the results of their diet programs, and so on, is being merged in their PHR. Their medical record has access to that information, so their physicians are certainly aware of it, but it's integrated within our kp.org website. Beyond that, we think there's a future in mobility, and I'll get to a topic before you ask the question. Members want access to information on their terms. We agree with that. We're spending a lot of time right now really thinking about how we support, in the appropriate way, member access to Kaiser Permanente through KP apps that give them both health and services access, as well as access to their medical record in a secure manner. In addition to that, inside our system, we're looking at mobility for our physicians and our clinicians, and how we're going to integrate mobile capabilities across our health system.
So I've seen in the Garfield Center, your innovation center out in San Andrew in Oakland there, near Oakland there, you've got testing of not only stuff that you're building yourselves, but a lot of other bits and pieces and other different types of technologies. Some of them around this video stuff, but some of them obviously are communities or other tools for clinicians. And there's a little bit of building I know going on within some other parts of Kaiser, some experimentation. How do you figure out at what point you either do the Google thing and open up your Maps API to everyone to build something onto it so that you can take your data anywhere, or how do you figure out how things get introduced to the KP.org and KP Apps family?
Well, I can tell you that I start with managing information and privacy as a core element of our organization. It's a trust relationship and a trusted relationship between patient and doctor. And the patients also expect a trusted relationship with their information, where we're protecting the security of that information. So in terms of what we let into our system and how we give access to those tools to our members and others, it's very carefully thought through, keeping that core concept in mind. In addition, we do continuously look at the services our members are looking for and the capabilities they want access to manage their health in a proactive manner. And that's part of who we are. So we'll continuously integrate third-party product services through access to kp.org, but also, as I said, through the mobile channel over time.
I like it. I was in a meeting, I don't know, 5 years ago when someone was talking about when Health Connect was going in, and some of the guys was presenting, I forget who, and some of the audience asked the question and said, hey, did you guys do any testing of this before you put it in? And I went, you probably should understand a bit about Kaiser before you ask that question. I don't expect you guys to be doing radical experimentation, but things get carefully researched and thought through, I know, in your organization before they hit the wire. So it's,
sure do.
So it's why it's not always immediately fast, but in healthcare you don't have to be that much faster to be ahead of the pack. Right. I'm speaking with Phil Fasano, who's the EVP and CIO of Kaiser Permanente. Phil, thanks for your time today.
Thank you very much.